Hi, I'm 29 years old, I'm a dentist. 3 months ago I started experiencing severe leg pain. I went to my GP who prescribed me anti-inflammatories, painkillers and muscle relaxants over a period of 4 weeks. There was no improvement and I got in contact with Dr. Ranganathan who took an MRI, and after the MRI we saw that we had a prolapse disc, the L5-S1 region. We decided to go for a minimally invasive approach to start off with, which was with a steroid injection in my back. Very professional, everything was great. Unfortunately, that treatment wasn't as successful as we hoped. And then we decided to go for a minimally invasive back surgery, so keyhole surgery to do a lumbar decompression. That was the best treatment I've ever had in my life. I've never experienced pain as much as I had it before, where I had to be bed bound and I wasn't walking for nearly 2 months of my life. I could barely stand for a couple of minutes before being in unbearable pain. And then immediately after the surgery, I had no pain whatsoever. Just a bit of discomfort around the spine, which is expected because that's where the incision was. But since then, I've made such a dramatic recovery. I'm post 3 weeks and I'm literally in the best condition I've been in for the past 4 months now. Thank you.